The article explains how the corruption in the Philippines harm public health by diverting billions of pesos away from essential projects like flood control, healthcare, and education. Because of stolen funds, communities face higher risk of diseases, lack of medical supplies, and disruptive services. The article emphasizes that corruption weakens the social conditions people depend on, such as safe environments, nutrition, and access to healthcare, leading to worsened outcomes for Filipinos. Our presentation today is about corruption in the Philippine healthcare system. Based on the Manila Bulletin article, how does corruption affect the health of Filipinos? The article starts with the shocking discovery. Billions of pesos were lost to ghost flood control projects. Because of corruption, many flood-prone control areas stay dangerous. And every time flood happens, diseases spread, like leptospirosis, dengue, diarrhea, typhoid, and hepatitis. Food and water gets contaminated, kids become malnourished, and families end up in evacuation center. These are real health effects that simply happen because the funds didn't go where they were supposed to. The writer explains that corruption doesn't harm just one patient. It affects the social determinants of health like education, nutrition, safety, and access to care. When money for this program is stolen, people make poor health decisions, get sick more often, and lose their chance to improve their lives. Even major systems like PhilHealth and the Universal Healthcare Law are mentioned as target for corruptions. These are supposed to help millions of Filipinos, but funds are misused, everyone suffers. In conclusion, the article makes it clear that corruption in the Philippines doesn't only waste our money. It leads to sickness, hunger, and even preventable deaths. And if we don't hold the people accountable, more cases like this will soon to happen. Our group will break this down further. Carl will discuss the summary and ethical issue. Gage will explain the natural law perspective. Harris will connect this to our nursing profession, and Kian will share key insight and references.
Moving on from the title and source, let us move on to the summary and ethical issue of this specific article. Now, this article talks about how billions of pesos are lost to fake flood control projects in the Philippines. Now, members of Congress and some senators were implicated, where money meant to protect flood-prone communities was stolen, wasted, or spent on projects that never existed. And it shows how likely just one example of how widespread corruption is in our government. Now, this article also talks about how health is directly affected by corruption, where floods that are continuing in unprotected areas are causing diseases like dengue, leptospirosis, diarrhea, and typhoid fever. And this can cause human health to decline and even death. And also destroyed crops that can lead to hunger and malnutrition among our people. Now, additionally, children miss school, which affects learning and long-term health among our youth. Now, moving on, this article also talks about the story of Rosario, how corruption made an impact to human society. Now, Rosario was a 1-year-old girl in Metro Manila, and she died from diarrhea and measles. Now, her family was poor and lacked education, leading to poor health choices like not vaccinating their kids or even using baby formula. Now, because of corruption, the local health center had no medicine from where they are supposed to help them. Now, because they can't help them, the family was forced to use a private hospital, incurring debt that could be avoided. Now, because of this, even though they use a private hospital, After a week, Rosario unfortunately died. Now, this highlights how social determinants of health, like education, nutrition, income, and healthcare access, are affected by the so called corruption within our government. Moving on from the summary. Now, let us talk about the ethical dilemma of this article. Now, public officials are supposed to protect citizens using public funds. Instead, some chose personal gain over public duty, which conflicts between public responsibility and self-interest of those people in power. Now, why is it an ethical concern? Well, it is kind of obvious. Corruption directly harms people's lives and well-being. It causes illness, poverty, and death, especially for the most vulnerable. It violates justice, fairness, and the moral duty of government to its citizens. If unaddressed, more children like Rosario will suffer preventable problems. Now, all I'm trying to say is that corruption is not just a financial or political issue. It is a moral and public health issue, where protecting lives requires accountability and ethical governance. Moving on to the natural law analysis, which would be discussed by another member.
In any healthcare system, trust is what builds the foundation for it to function. This is because people place their lives at the hands of the hospital workers. Therefore, medical professionals should not break this trust given to them, and instead always strive to apply honesty in their profession. Because when honesty becomes the standard in any kind of workplace, or the medical field for example, obviously, corruption will be less likely to spread out since everyone is truthful and transparent with each other. Now we move on to the next principle. In my opinion, I believe that this is the most main principle that applies to healthcare. Healthcare is based on the specific purpose because in definition, healthcare is to save lives after all. For this reason, anyone in the medical field must always prioritize to preserve the lives of others. Leaders must always make choices that benefits everyone. Since corruption reduces or at least hinders the funds or resources meant for the medicine of sick individuals. Leaders must always make choices that benefits everyone, since corruption reduces or at least hinders the funds or resources meant for the medicine of sick individuals. And when resources are used for their correct means, of course, more patients are more likely to be treated in time and the hospital can respond quickly in emergencies. The idea of common good states that our actions should benefit everyone, not just ourselves. What this means is that we should apply equity, being fair and just, especially in a way that seeks to address existing inequalities. For example, us nurses have the resources in our hands to cure patients that are suffering from the illness. For that reason, it is our duty to use these skills efficiently to help individuals equally, no matter the appearance, beliefs, and status in life. Every person deserves to be treated with respect. However, as far as corruption is concerned, the public is led along something that does not exist, which is accessible healthcare for all. They are fooled thinking they will receive proper medical service when in reality, resources have been diverted elsewhere. The Republic Act 1123, the Universal Healthcare Act, states that the country must protect and promote the right to health of all Filipinos. However, corruption is what you could say degrading to human rights of people. Because why is it that people are denied of what they rightfully deserve, even though they contribute to the system through their taxes? What they realize at the end of the day is that the money they pay is misused. Their contribution does not lead to the healthcare and services they were promised. And lastly, the principle of reason and responsibility simply reminds people to act responsibly, especially to individuals in positions of power, because the choices that these officials make will benefit or destroy the public's trust.
Good day, everyone. When we hear the word corruption, we often think of money, politics, or government offices. But have we ever stopped to think, how does corruption affect our health? As future nurses, understanding this is important because corruption in our country doesn't just steal money, it steals lives. Corruption affects the health of Filipinos in many invisible but serious ways. When government funds are meant for hospitals, medicines, or health programs are lost to corruption, the first to suffer are the poor. The people who depend on public health care. Imagine a barangay health center without enough medicine because someone took part of the budget, or a hospital without proper equipment because funds are misused. These are not just statistics. These are real patients who could lose their lives. Corruption also leads to unequal access to healthcare. Wealthy individuals can afford private hospitals, while ordinary Filipinos line up for hours in a crowded public facilities. The result? Delayed treatment, poor sanitation, and prevention of death. In short, corruption widens the gap between the healthy and the sick, the rich and the poor. Even during emergencies. That's why integration, even during emergencies, corruption shows its deadly face. We saw this during the pandemic. Overpriced equipment, delayed distribution of aid, the poor coordination in health responses. Nurses every peso should lost to corruption could have brought protection gear and compassion, vaccination for children, or food for hungry families. That's why integrity must always be a part of our practice. Nurses should be model transparency, accountability, and compassion. Values that fight corruption in a small but powerful way. Simple actions like using resources properly, reporting flaws, and standing up for ethical care already makes a difference. In the end, corruption is not only a political problem, it's a public health crisis. It weakens our hospitals, denies people of care, and endangers lives. But as future nurses, we have the power to heal not just the sick, but also the system by choosing honesty and service over silence and greed. As future nurses, this issue matters deeply to us. Nursing is not just about giving medicine or checking vital signs. It's about advocating for human life and justice. Corruption violates both. A nurse who ignores corruption is like a doctor who ignores infections. It spread and it kills silently.
What happens when the money that is meant for hospitals, medicines, and flood protection never reaches the people? The answer is very simple. Filipinos get sick, our communities suffer, and sometimes lives are even lost. Corruption in the Philippines doesn't just drain our money, it directly harms our people. Billions of pesos lost to ghost projects, especially in that flood control, could have funded hospitals, medicines, and even healthcare programs. But instead, when the funds are stolen, a bunch of communities suffer. Flood-prone areas continue to flood, which led to diseases like leptospirosis, dengue fever, diarrhea, hepatitis, and many other. Flood also disrupts our farming and food supply, and that causes hunger and it sometimes worsen the malnutrition issue among the children. Additionally, school closed during disasters, and the long-term effects on learning care is very severe. But corruption doesn't only cause direct harm, it also creates a massive indirect damage. When the budget items are realigned to benefit the corrupt officials, some essential services like education, healthcare, and training suffer. Because the missing counterpart funds even cause foreign assisted projects to be cancelled, and that means the country loses millions of dollars in potential aid. And to understand how the corruption touches individual lives, the article shares the story of Rosario, a 1-year-old girl who have died from diarrhea and measles complications. Her family lived in a deep poverty. They have struggled with malnutrition and lack education to make good health decisions. And what's worse is, when Rosario needed medical care, the local health center had no medicine. And the reason because the budget was allegedly stolen. Miss Rosario was forced into a private hospital, and eventually, the cost pushed her family into debt. And because of that, she only died. Rosario's story is not an isolated case. It represents how corruption destroys social determinants of health like education, nutrition, housing, and access to proper care. This article has shown us that corruption is not just a political issue. It is a public health crisis. From the lens of natural law, corruption violates several key principles. But first is the pursuit of truth and honesty. Health officials should manage the funds with transparency so the public can trust that resources truly reach the patients. And second is the preservation of life. Every peso lost to a corruption is a life possibly endangered. And third is for the common good. Resources must serve the whole community, especially groups who depend on public health care. Fourth is the promotion of human dignity. Corruption reduces people to victims. It forces them to suffer due to missing resources. And lastly, natural law emphasizes reason and responsibility. It reminds leaders that they must wisely and responsibly manage the funds that is entrusted to them. The article concludes with one strong message. Corruption causes economic loss, but more importantly, it costs Filipino lives. Unless corrupt officials are held accountable, more families will experience tragedy that the Rosario family has endured. In the end, corruption is not just about stolen money. It is about stolen health, stolen opportunities, and stolen lives.